Agent Survival Guide podcast. This is the Friday 5, our weekly list of 5 things you should know about. I'm your host, Sarah Ruppel, wishing you a happy Friday as we kick off the beginning, or should I say the early beginning of another weekend. We'll start out at number 5, almost right where we left off last week, which was with the mention that as the new administration comes in and gets their bearings, a lot of legislation and proposals will be reviewed and possibly changed between now and implementation. On Monday this week, after taking office, President Trump signed quite a few executive actions, one of which included his memo regarding a regulatory freeze pending review. This memo states that the new administration must review new proposals and rules before they are sent to the Federal Register for publication. Any pending legislation that has already been sent to the Federal Register but not published must be reviewed as well. And then there's also a request for a 60-day look-back period for rules published in the Federal Register but have yet to take effect. That is quite a bit of legislation to look through, and I have no doubt we will see changes come through. And as those changes come, we will be sure to keep reporting on them. I mentioned refreshing on the CMS Newsroom website last week. That main page has largely been wiped of content. So if you went there and just saw the CMS header, same. We are keeping an eye on the site like we always do, and we'll be reporting back here with updates. Moving on to number 4 on our list, an update to the ban on TikTok. True to their word, ByteDance shut down service to TikTok, Lemonade, CapCut, and a handful of other apps for U.S. users on Sunday, January 19th, as the law required. And interestingly, that included some apps that I did not previously know were developed by ByteDance subsidiary companies. The TikTok ban lasted for about 14 hours until President Trump stepped in to say that his administration was interested in working towards a resolution. ByteDance restored service to TikTok first, then gradually began restoring service to the other apps that had gone dark. So for users that already have the app downloaded, functionality has been restored. However, the apps are still not available for download in app stores. As I mentioned, there were a few other apps that found themselves also banned. Apple had a list that included a few more than what we've mentioned here, but that list is by no means exclusive. TikTok was definitely the most prominent of all of those apps, with a user base of 170 million Americans. President Trump's executive order gives his administration 75 days to, quote, determine the appropriate course forward in an orderly way that protects national security while avoiding an abrupt shutdown of a communications platform used by millions of Americans, end quote. Trump called on the Attorney General to evaluate the situation and offer written guidance. Pam Bondi is his current nominee for that position. Her confirmation vote has been set for Wednesday, January 29th. The countdown for the U.S. government and TikTok to come to a solution now runs out on Saturday, April 5th. Moving on to number 3. When TikTok went dark, so did CapCut, ByteDance's AI-powered video editing app. And literally moments later, Instagram announced Edits, which, according to Instagram CEO Adam Mosseri, won't just be a video editing app. Quote, it's a full suite of creative tools. There will be a dedicated tab for inspiration, another for keeping track of early ideas, a much higher quality camera, end quote. He also goes on to mention editing tools, draft sharing, and analytics. I have not tried CapCut, so I can't claim, like many others are claiming, that this is a grab for that particular audience share. But Messeri claimed that Edits was more for creators than casual users. Hard to really say until the product launches in mid-March, but you can pre-order the app now, which I do find interesting, and yes, I did pre-order it. Of course, CapCut is now back to being available for those US users who had previously downloaded it. So we'll be filing this one under wait and see, and we'll definitely report back with updates. Number 2, an interesting study from the Journal of Gerontology Medical Sciences found that there is an optimal temperature for senior brain health. Reading through the study, I'm honestly curious what the optimal temperature is for all ages, but I digress. Other than the optimal temperature range, the study found that if the temperature goes up or down just 7 degrees outside of this optimal range, the inability to focus doubled. The study found that the optimal ambient temperature for a senior between 68 and 75 degrees Fahrenheit. Researchers cited the impact of climate change on seniors' ability to function should they not have proper heating or cooling systems in their homes. Also mentioned in background notes, as we age, we are, quote, less capable of responding to dramatic swings in temperature, end quote. I am certainly not at that age range yet, but I can confirm that's true for me, and my health is not currently affected by a chronic illness or medication that could potentially affect my inner thermometer. We'll be linking to a few articles published around that study. Could be a fun fact to mention in your newsletters, or get the conversation going on social. I know the thermostat can become a hotly contested debate. In our home, more so in the summer months than the winter months, but this is actual scientific evidence. that there is a range that we should probably all be abiding by. And finally, our top story coming in at number 1 this week. Last Friday, amid a flurry of legislative announcements and activity, CMS released another report on enrollment numbers for the 2025 ACA open enrollment period. Total marketplace enrollment came in at 24,166,491 plan selections for the 2025 plan year. Consumers returning to the marketplace made up just over 20 million of those enrollments. And then new to the marketplace consumers accounted for the remaining almost 4 million plan selections. Looking at the numbers for Healthcare.Gov marketplace enrollments, just over 17 million plan selections made, over 14 million of which were returning consumers, while 2.8 million new consumers enrolled. Moving over to the state-based marketplace side of things, over 7 million consumers signed up for plans using the state-based marketplaces. Almost 6 million of those enrollments were returning consumers, while over 1 million consumers were new to buying state-based marketplace coverage. And then as far as state specifics, we do like to drill down. So far, neither CMS or HHS have reported official state totals, probably because a couple of states still have open enrollment periods going, so we'll have a little bit of a wait there. Healthcare Dive had numbers from a few states. We'll be linking to that article in our episode notes, so you can check to see if your state has reported their totals. And then we'll report back here with official final numbers after enrollment closes out, and we can give you a snapshot of a couple states. We don't want you to miss out on that episode, so make sure you're following along with our show. You can do that in the app that you're listening on right now, whether that is Apple Podcasts, Spotify, Podbean, or another listening app. Just hit that follow button or the plus sign and you'll be good to go. And thank you so much for listening today. I hope you have a great weekend. Stay healthy and stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Tina Lamoureux. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Follow along with us wherever you like to listen.